Hi guys, this is Dr. Joe Borio with this week's Health Kick. Real excited, I got some great information to share with you today. We've talked about nutrition and exercise. We've talked about different types of meals that you can put in your body. We talked about a morning health drink. Today I want to talk about the nervous system. Why? Because it's the most important organ of your body, and I think it's something that we're not really aware of as a public, how important it is to take care of it. So before I share a study with you, I just want to kind of share with you how the body works. What's up here is your brain. And what your brain is essentially it's a computer. Better than that, it actually generates electricity. It actually makes electrical impulses. They're intelligent impulses. So much like a computer attaches, think of your liver like a printer. Your computer sends information down, giving the organs direction of what they're supposed to do. The organs and so forth send information back up the spine, up into the brain. So there's this constant flow of signals, these intelligent electrical impulses that run through the nerves that go up and down the spine. Okay? Now the spine can shift out of alignment, as you guys know. So the nerves are kind of soft, mushy wires, and if you press on them, it lessens the flow of electricity. It lessens the messages. So if I decrease the electrical intelligent messages to the organ, look at it this way. If you don't have a good connection between your computer and your printer, how well is your printer going to work, right? How well is the print going to come out? Same idea. How well is your liver going to work if it's relying on information from the brain to do what it's supposed to do, or your heart, or your lung, or your kidney, or whatever? The body part's not going to work so well. Now, one of the biggest problems we have as a culture is we've kind of been taught that symptoms have something to do with the onset of a disease. And nothing can be further from the truth. We know through science, through pathology, that a minimum, guys, of 40% up to 70% of the tissues, the organ, the health of any body part, the arteries, for example, are blocked, diseased, dead tissue before you ever begin to feel a symptom. So by the time you hurt, you are essentially in crisis. Now, often people think the onset of their symptoms means the onset of the problem. You wouldn't do that with a heart attack, right? I mean, if you had a heart attack, you wouldn't go into the doctor and say, geez, I don't know what happened. My arteries are perfectly clear, and I didn't have any problems last night when I went to bed, and now I wake up and they're 90% blocked. I mean, we all know, just even common sense, for example, that takes 30, 40 years to develop before you'd ever have crisis. So remember, by the time you have the heart attack, you are in crisis. By the time you have any disease, any symptom in the body, you have a significant amount, even if it's from trauma, you have a significant amount of damage, of injury, of disease, sickness, illness, or death to tissue in the body before you'd ever know that there was a symptom. Here's the other problem. We're taught that when symptoms originate, you swallow down pills, right? So we're taught that, hey, look it. You don't have nerve endings in your body to tell you something's wrong. We're educated in our society that you have nerve endings in your body. When they start to hurt, that means it's time to take a pill. So, if my blood pressure's up, if my heart hurts, if I've got digestive trouble, hell, if I'm depressed, if I'm too happy, if I'm too sad, if I can't go to the bathroom right, if my back hurts, if my knee hurts, if my legs are restless at night, whatever, that's time to take a pill. All that does is it masks the symptoms. Your body's crying out, telling you you're in crisis, that you're significantly sick, that you have illness. You're taking pills, and all it does is what? Covers up the symptoms. Then what? Your body just goes on and gets sicker and sicker. Then you take more pills and a specialist and more tests. Then you start cutting body parts out. And I'm not saying that never, ever needs to be done, guys. But the reality is that's not the way your body was intended to be. If I ask somebody, anyone on the street, were your teeth intended to last you your entire lifespan? Just about everybody says, yeah. So how would you ensure that your teeth are going to last you your entire lifespan? Well, I'm going to brush them, I'm going to floss them, I'm going to take good care of them, and I'm going to make sure I do that regularly throughout my lifetime, not just when they hurt, so that they stay healthy and they stay bright and clean and they last me my entire lifetime. And that makes sense to just about anybody. The spine is the same way. It needs lifetime care in order to stay well. Most people don't know this. So why did I want to talk about neurology today? Because there was a study done in the early 1900s. It was called the Windsor autopsies. Amazing study. What it showed was that Dr. Windsor did autopsies on people, and animals and so forth. And he found that there was 100% correlation between the health of the nervous system at a vertebral segment and the health of the organ. So if you think of your vertebrae like little breaker switches, like light switches in your house, each switch goes to a different light, right? Each switch or each breaker goes to a different circuit. The same is true with your spine. Each vertebrae is like a breaker. That one might go to your liver, your pancreas, your kidney, your immune system, your heart, your lung, whatever, right? So that's basically how it works. So if that segment of the spine was sick means out of alignment. Subluxated is the chiropractic scientific term for it. But if it's subluxated, if it was degenerative, if it was arthritic, if it was stenotic, if it was bulging and herniated and so forth, it shuts down those messages, those significant intelligent messages that go from the spine out to the organ, and the organ developed disease, sickness, illness, or death. He found it in 100% of the cadavers that he worked on. 100%. So if this part of the spine was sick, that organ was sick. If you checked the organ and traced it back, that part of the spine was sick. What a back and neck pain tells me is that that area of the spine is sick. It doesn't mean that that's the problem. Let me give you another example. If my left arm hurts, right, and I'm having a heart attack, the cardiologist in the emergency room could care less about the pain of my left arm. He doesn't care if it's in your pinky, your elbow, your shoulder, whatever. Once he knows you're having a heart attack, all he knows is what? This is where I need to render care. This is where this person needs immediate treatment, because this is only a symptom of the problem. When somebody comes into my office with neck pain, back pain, whatever, that's only a symptom of the problem. There's something else much more serious going on, and that means that area is 40 to 70% sick before they even started feeling it. So they're in a significant degree of crisis before they would ever consider calling me. Well, usually it's worse than that. What happens? You get a neck ache, a back ache, your lower back hurts, you got stomach trouble, whatever. Most of you don't run to the chiropractor. Most people, they start swallowing down a handful of Advil or ibuprofen or Vioxx, Celebrex, Mobic, Naprosyn, whatever, as if that's the problem. Again, your nerve endings aren't firing off to tell you it's time to take a pill. They're telling you something's in crisis. Not that it's beginning to get sick. It's been sick for a long time, and now I'm in crisis. It can no longer take care of itself. A large study came out by OSHA where they looked at children, and they found out that children actually had a significant number of falls, about 10,000 falls, and by the age of 12, 13, a significant number of children had the beginnings of degenerative changes within their spine. So what that means is if their spine's starting to get degenerative at that age, they're blocking the messages from the brain to the organs at those early ages. And now what are we seeing in children? We're seeing more organ disease now than we've ever seen in the history of our children. So it really starts to put things together when you look at it that perspective. The best time to start care is when you're born. The absolute best time to start care is right after birth. We know through a lot of science that the birth process itself causes the spine to get jammed up or stuck or subluxated or sick. So you get an immediate change in the way those messages are going up and down the spine. When's the next best time to get adjusted? Now. Now's the best time. And when? Regularly. You brush your teeth twice a day, you floss them, you go to the dentist twice a year, every 6 months to get them professionally cleaned. Even with all that care, you need to get in the chiropractic office a minimum of once a month in order to keep the spine healthy, keep it adjusted, keep the spine in good alignment, allow the messages to get there. The spine needs to be regularly maintained and cared for your entire lifespan. If not, the body will deteriorate. It'll die. Now, there's a new study done in neuroscience that backed up everything the Windsor autopsy showed. It did exactly what the Windsor autopsy showed. It showed that if the spine got sick or stuck or diseased, it blocked the messages to the body, and therefore what? The organs got sick or diseased, and the body didn't work as well. It didn't live as long. There was sickness, disease, illness developing in your organs. So all this research done in the early 1900s has all been repeated. It just got printed out in the neuroscience a few years ago, and that tells us even more so that we need to do a better job of communicating why people need to be under regular chiropractic care. Make sure you make an appointment for you, your children, your entire family. If it's not in my office, I don't care where you live, I don't care what state you're at, make sure your whole family's under regular chiropractic care. Eat well, I want you to exercise, I want you to drink a lot of water, I want you to get a good night's sleep, I want you to do some good self-talk. Make sure you're saying good things to yourself in your head, and make sure you and your entire family are under regular, lifetime chiropractic care. This has been Dr. Joe Borio with this week's Health Kick. Have a great, awesome, healthy week. I'll talk to you guys next week.